Now the problem, ma'am, is your party is being sledged, heckled and hassled by the opposition. They're obviously trying to find fault with what you're doing. They were trying to find fault when you were buying the vaccines yourself. They confused you. They put you under pressure. You changed the policy, allowed states and hospitals to buy vaccines themselves. Now states are scrambling. It's no longer a buyer's market because the seller's market. There are more people trying to buy than there are trying to sell. And now you realize the problem with the policy you rolled out. If you were confident about what you were doing, you would have not allowed the opposition to confuse you and backpedal from what now seems to have been the better policy in the first instance than what we are stuck with right now. Why is the government so confused, ma'am?
Rahul, opposition always wanted to look for an opportunity, and opposition is looking for an opportunity here too. This is one part. Now, whatever I say has two parts. Please give me some time to respond to whatever you have been saying and whatever the other esteemed panelists have been saying. Number one, from 1st May, liberalized national vaccine policy is under implementation. Now, how was this particular vaccine policy formulated? This vaccine policy is the outcome of stakeholder consultations. We spoke to all the chief ministers. We spoke to all the domain experts. We spoke to all the bureaucrats all across. I'm not saying the central government. Central government was in touch with all the state governments, all the chief ministers, cutting across party lines. And you know what? Most of the chief ministers of the opposition ruled states said, we wanted decentralization of the vaccination process. We wanted autonomy. We wanted independence. We want to go to the open market. Now, I am a Bhubaneswar Lok Sabha MP. I'm from Odisha. The Odisha Chief Minister also has written to the Prime Minister saying that we want to procure vaccine from the open market. And Honorable Prime Minister and his entire team thought it would be right if we involve these state governments, and they are our partners. It's cooperative federalism, it's a federal structure. So let the state governments come forward, and we would be kind of creating a favorable ecosystem. We means the central government. We would be creating a favorable ecosystem.
Do you believe now, you're giving me, you're couching your answer with a lot of diplomaties. I'm asking you a straight question. Do you think we have a better policy today than we did earlier? Or do you accept that we made a mistake? We made a mistake.
I certainly believe. I can say with all conviction at my command that this is the outcome of stakeholders' consultations. Many minds have met, and this is the right kind of policy.
No, ma'am, it's not. No, ma'am, it's not. And I'll tell you why. Let me explain to you why this is not the right policy. Because you now have a situation where you have all the states of India trying to find some way of squeezing vaccines out of the vaccine manufacturers, which is leading to the vaccine manufacturers commanding whatever price they want, and therefore we're having to pay much more than if the government had purchased. You would have had the ability to drive down prices as you did initially and purchase in bulk at the lowest possible rates.
Rahul, just listen to me. As far as 45 plus is concerned, the other day, the Union Health Secretary has convened a meeting of all the state health secretaries, and he has been very candid about one thing. I really like the clarity with which he spoke, the clarity with which he issued instructions. He said, every 14 days, we will be kind of assessing the consumption, and we would be seeing the level of availability, the amount of vaccines available with the states, and for the next fortnight, we will be giving the vaccines for 45 plus, which Rahul, the center is bearing the cost for. This is one part, and I assure you, right now, you rightly mentioned, in fact, it's being shown on the monitor also, we would be going up to more than 13 crore doses per month from July. I understand it's slow. I fully understand. We know how to see our face in the mirror. We know it's slightly slow at this juncture. But at the same time, Sputnik 5 has come. And you please remember that there are 3 PSUs. 3 PSUs, I would like to name these PSUs. We have gone to these PSUs.
Rahul, can I please come in?
To kind of list out all the vaccine manufacturers. These are Indian Immunologicals Limited, Hafkind Biopharmaceutical Limited, and Bharat Immunological and Biologicals Limited.